I think we're going to go ahead and they will join us. Well, we're already going. It's already 10 minutes past 12. Good afternoon again. Let me start by the protocol. So we are so very glad to have you here, Her Excellency Hajia Aisha Ummi Garba El-Rufai, the wife of the Executive Governor of Kaduna State and Chairperson of Kaduna, Mr. Abdulsalam Ozigis, Deputy Director of NAFDAC, the directors and deputy directors from various MTAs that are present here and from other government agencies, partners from other organizations, national and international, Mrs. Maryam Ahmed, our Global Youth Leader on Nutrition, Mrs. Purity Oriaifo, or representative of the Children's Parliament, the media, ladies and gentlemen, good afternoon, everybody. I'm very glad to welcome you all to this webinar marking this year's World Breastfeeding Week. We are delighted to have you all here, and we are very honored to have our prominent speakers who are some of the most active and passionate advocates for nutrition in Nigeria. As you know, World Breastfeeding Week theme this year is Support Breastfeeding for a Healthier Planet, and this is what our panelists will be talking about. Before we proceed on the opening remarks from our country director, let me just briefly run you through what the agenda is for the day. So after the opening remarks, we will have a few goodwill messages from federal agencies. Then we will have our Global Youth Leader talking about the theme for the year. We will then hear to Her Excellency, followed by our Girl Champion, then Mr. Ozigis, and Senatorial Oloriegbe, who is about to join us. There will be then time for Q&A and the last word from our panelists. We will round up with a call to action, and that will be the end of the day. As housekeeping, this webinar is being broadcasted live on social media. You may have noticed that you're muted, so please introduce yourselves in the chat box, as many of you have been doing, and use the Q&A box to ask your questions. Both of these buttons are at the bottom of your screen. So without further delay, let me just hand over to Ms. Shannon Ward, who will be doing the opening remarks for Save the Children. Shannon, your mic.
Sorry. Good afternoon, everybody. Sorry about that. Thank you, Karina. Let me start by saying that I stand on existing protocols, and I would really like to welcome everybody and thank you for joining us this afternoon. On behalf of Save the Children and our country director, Mercy Gichuhi, it's my pleasure to welcome you all. Every year, the first week of August, World Breastfeeding Week is celebrated to encourage breastfeeding and to improve the health of babies around the world. As Karina had indicated, this year's World Breastfeeding Week theme is Support Breastfeeding for a Healthier Planet. We all know that breastfeeding within the first hour of birth and exclusive breastfeeding for the first 6 months of life are crucial for a baby's health and growth, and also provide protections for the mother's health. Despite this, in Nigeria, less than 1 child in 3 benefits from exclusive breastfeeding, and early initiation of breastfeeding is not widely practiced. This year, World Breastfeeding Week is bringing our attention to the fact that breastfeeding also protects the planet at a time when climate change and environmental degradation are some of the most urgent challenges facing our world. In modern life, food systems and feeding habits contribute substantially to climate change and environmental degradation, but we can reduce our carbon and ecological footprints, starting with how we feed our babies. Breastfeeding saves gas emissions from dairy farming, packaging, pollution related to transportation, waste, etc. Save the Children has been supporting Nigeria's efforts to promote and protect breastfeeding for several years. When we implemented the WIN program, we implemented breastfeeding promotion interventions at scale, and we saw positive changes. Since then, breastfeeding and IYCF promotion have been integrated not only into our nutrition programs, but into our health, food security, child protection, and even our education programs. We are committed to continuing to work in collaboration with the government of Nigeria for mothers to be supported to breastfeed in order to bring up a generation of thriving children and to contribute to a healthier planet. With that, let me go ahead and thank you once again for joining us today. I know that many of us are busy with other commitments, so we appreciate the opportunity to come together on this important topic. Thank you, and have a great deliberation. Over to you, Karina.
Thank you, Shannon. So we're moving forward to goodwill messages. I don't know if Dr. Chris from Federal Ministry of Health is in line, or if there's any representative. Please let us know in the chat box. Meanwhile, I saw Mrs. Nelson from Ministry of Budget and Planning. Maybe we can start with her. Can we please unmute? Jerry, please, Mrs. Nelson Chito, can you please unmute her?
Hello?
Yes, we can hear you.
Yeah, good morning. I would say I would like to observe all established protocols. On behalf of the Ministry of Finance, Budget and National Planning, I welcome you all to this webinar in commemoration of the 2020 World Breastfeeding Week with the theme, Support Breastfeeding for a Healthier Planet. It's a fact that breastfeeding is associated with positive health outcomes. Children that were breastfed are healthy. Breast milk makes children healthy. That's what everybody knows. And when children are breastfed, they become better students, better adults, and productive individuals with good understanding of how their actions and inactions affect everything around them, and thereby working hard to have a peaceful and sustainable environment. It's true that breastfeeding does not waste scarce resources or create pollution. Breast milk is a naturally renewable resource that requires no packaging, shipping, or disposal of wrappers or cans, hence very environmental friendly. The theme, Innovative Strategies for Improving Breastfeeding and Nutrition in Nigeria, is very apt. Presently, it's very clear to all of us that most of our conventional ways of doing things are not working and giving us the desired results, thus requiring change of strategy. The Ministry of Finance, Budget and National Planning, in line with its mandate, will continue to provide effective leadership in ensuring that all efforts to improve our exclusive breastfeeding rates and nutrition status are supported. We thank Save the Children for organizing this. And on this note, I'll say welcome to all of you. Thank you very much for listening.
Thank you. I was so worried about muting the microphone that I didn't introduce her properly. So that was Mrs. Chito Nelson, Head of Food and Nutrition Division at the Ministry of Finance, Budget and National Planning. So I can see also that the distinguished Senator Ibrahim Oloriegbe has joined us. You're welcome. So Senator is the chairman of the Senate Committee on Health, and he will be one of our speakers. Welcome again. So if we don't have anybody from Federal Ministry of Health, I think we can go ahead. We'll be asking Ms. Maryam Ahmed, Global Youth Leader on Nutrition, to talk a bit to us about how breastfeeding helps us protect the planet and reduce climate change. Maryam, please go ahead.
Good afternoon, everybody. Thank you for having me here. I stand on existing protocols. Exclusive breastfeeding, especially for the first 6 months of a child's life, is important, as the nutrients that they obtain enables them to grow properly, both mentally and physically. But unfortunately, not every woman does that, and we need to promote that even more. Breastfeeding has been linked to higher IQ scores in later childhood. In some studies, breastfed infants are also more likely to gain the right amount of weight. And lastly, breast milk also contains naturally made antibodies that fight off diseases. Now, youth have a key role to play when it comes to continuity and sustainability, because we support and improve on good practices and then pass it on to the next generation, and then they pass it on to the next generation. So it becomes like good practices being adapted. So having said that, an increase in the rate of women exclusively breastfeeding for this period of time, which is 6 months, would reduce the need to purchase breast milk substitutes. Now, that then leads to less need for the use of materials, energy, and other things that are needed to follow the process of modifying the breast milk substitutes, packaging them, and distributing them as well. Also, recycling is not so common in Nigeria. So when these plastics and bottles are used, they are not properly discarded, which now adds to the issue of climate change. Hygiene can also be an issue as well, because especially in the rural communities where access to clean water may be difficult. It's also mostly way cheaper to breastfeed than to purchase a breast milk substitute. So the money that you would use to buy the breast milk substitutes can be used to pay for important things like education. Thank you very much.
Thank you, Maryam, for setting the tone of the discussion and introducing us to the topic of this year, World Breastfeeding Week. We will now move ahead to have Her Excellency, Mrs. El-Rufai, talking about what systems Kaduna State has put in place to protect and promote breastfeeding, and what are the successes they've achieved so far. You're welcome again.
Good afternoon, everyone. Permit me to also stand on already established protocols. I seem to have a very long speech. I don't know how many minutes I have to speak. First, I would like to congratulate and express my appreciation to Save the Children International for this webinar on innovative strategies for improving breastfeeding and nutrition in Nigeria. With the 2020 theme for this World Breastfeeding Week being Support Breastfeeding for a Healthier Planet. It is pertinent for all stakeholders to know that the present government of Kaduna State, since its assumption in 2015 as an essential component of the state human capital, economic growth and development that must be given adequate consideration for the future generation and meaningful progress of the state. Our goal is to continue working, engaging, and mobilizing stakeholders locally and internationally towards making our states well-nourished, in which citizens will effectively contribute to the economic growth and prosperity of the states and the nation in general. It was against this development that His Excellency, the Governor, after my consultation with stakeholders, agreed to establish a high policymakers platform known as the Kaduna State Emergency Nutrition Action Plan, Kaduna. Dr. Salma, who is in the audience somewhere, has been an integral part of this. From various nutrition-related sectors that serve as catalysts in the group in bringing to an end the scourge of malnutrition in Kaduna State, and to also champion the cause for the treatment, prevention, and scaling up of community infant and young child feeding, CIYCF. So it is important to say that Kaduna, which I'm heading in Kaduna State, has brought on the promotion, protection, and supporting breastfeeding, particularly early initiation of breastfeeding, exclusive breastfeeding, and complementary feeding through collaboration and partnership with different organizations, beneficiaries, health workers, community leaders, community volunteers, the CIYCF women support groups, husbands, religious leaders, etc. I have been asked to comment on the systems that are in place to protect, promote, and improve breastfeeding in Kaduna State. So we have a number of policies, strategies, plans, coordination platforms, CIYCF support groups, etc., towards protecting, promoting, and improving breastfeeding practices in the state. As said today, our CIYCF intervention reaches out to 20 out of the 23 local government areas in the state. And prior to the establishment of Kaduna, it was only one LGA, which was Kajuru, that was implementing the CIYCF program. Similarly, we have developed maternal, infant, and young child strategy and its operational plan, which is jointly being implemented both at primary and secondary health facilities of the state. I am pleased to let you know that our intervention on maternal, infant, and adolescent nutrition has also reached out to 13 of the 23 LGAs of the state, and about 150,000 beneficiaries have been reached within the first year of its implementation, from July 2019 to July 2020. In addition to these, Kaduna State developed and is implementing its food and nutrition policy, state health sector strategic plan of action on nutrition, state infant and young child feeding, social and behavioral change communication strategy, state multi-sectoral plan of action on food and nutrition, etc., all in a bid to improve nutrition and breastfeeding in the state. On protecting breastfeeding, Kaduna State had reviewed its maternity leave for its female public workers from 3 to 6 months with effect from August 2019. Currently, we are working with Save the Children in supporting us to develop a bill for the 6 months maternity leave legislation, and this legislation of protecting maternity leave will be the first of its kind in Nigeria, by God's grace. The State Ministry of Justice is working towards this bill. It is our expectation that before the end of this quarter, a zero draft of the bill will be shared to our state stakeholders for inputs. We have the commitment of getting this bill finalized and submitted to the state's Executive Council for review and submission to the State House of Assembly before the end of the administration, to His Excellency, Governor El-Rufai. The practice of breastfeeding, especially exclusive breastfeeding, must be protected considering its importance towards the development of a child. Legislations and active implementation strategies must be put in place to protect this practice. As you all know, last year in 2019, the federal government of Nigeria approved a new regulation on marketing of infant and young children, food and other designated products, the registration, the sales, and things like that. In Kaduna State, we have been working with NAFDAC to curtail inappropriate promotion of baby infant formula foods at our various hospitals, even though the monitoring and enforcement of BMS code and Nigeria regulations are still weak. The promotion of breast milk substitutes by infant food company representatives is a major concern and must be addressed by the relevant authorities. We must work jointly to stop all forms of donation or free samples of this infant formula products in our health facility hospitals and their direct interaction with health workers at health facilities. It was on this commitment that the Kaduna State government ensured the incorporation of breast milk substitute matters into our health component of nutrition strategies and operational plans. We will explore ways of establishing a special multisectoral committee in collaboration with NAFDAC to enhance monitoring and enforcement of the new regulation on marketing of infant and young child food and other designated products in Kaduna State. As at today, all our 23 local government areas have 3 budget lines on nutrition related to intervention with funding allocations of at least 20 million naira in 2020 approved LGA's budget. These budget lines are the IYCF budget line, Food and Nutrition Coordination budget line, and the CMAM budget line. These are in addition to the other food and nutrition related funding items at states across sectors. In promoting breastfeeding for a healthier planet, breastfeeding must be promoted by governments, private organizations, religious and traditional institutions, communities, and caregivers. In Kaduna State, we're working tirelessly towards promoting breastfeeding at various levels, including at health facility, community, social gatherings, and through the media. Currently, our primary healthcare services have been integrated, and this means that nutrition services will be promoted at different platforms. Recently, the governor approved the recruitment of 3,000 healthcare cadres, including nutritionists. We are making this effort to bridge the existing gap of inadequate qualified health personnel to provide needful nutrition counseling to caregivers at the community and hard-to-reach areas of the states. Similarly, we have established nutrition counseling corners in many health facilities of the state, particularly in our primary healthcare centers, in order to increase knowledge and skills for breastfeeding before the delivery and improve our breastfeeding and nutrition indices at community levels. The caregiver or mother must be supported to initiate, establish, and continue breastfeeding as soon as possible after birth, within the first hour after delivery. Mothers should be discouraged from giving any food or fluids other than breast milk for 6 months unless medically indicated. For these particular kinds of communication, we have our food soldiers. We call them our food soldiers. Our people. We have food soldiers that go door to door to talk to women about breastfeeding, about early initiation, about the needs for the proper kind of nutrition for the mother and the child, and when to even begin complementary feeding. So to promote breastfeeding, we need to step up our campaigns and nutrition interventions in the country. There's need to also strengthen engagement with the traditional and religious leaders and other community groups to promote breastfeeding. Events such as the World Breastfeeding Week are as important as everything else regarding breastfeeding and the promotion and the strategy that surrounds it. This should be championed and supported by wives of governors in their respective states, considering its potential of promoting the practice of exclusive breastfeeding. Wives of governors need to prioritize and champion nutrition interventions in their states. Some should apply to wives, the same should apply to the wives of local government chairmen in all states. Furthermore, to promote exclusive breastfeeding, there is a need for socioeconomic empowerment. A mother who is not well fed will not adequately breastfeed, hence the need to empower them with seed stock or startup capital. This in Kaduna State, the government is doing through the Ministry of Human Services and Social Development. For improving breastfeeding, there has to be an improved breastfeeding support system. There is the need for proactive engagement with all relevant stakeholders, governments, policymakers, legislators, traditional and religious leaders, civil society groups, non-governmental organizations, community-based organizations, community support groups, the media, the husbands, the caregivers, the mothers, grandmothers, mothers-in-law, who tend to always put their feet down to say that the wives of their sons must include other forms of feeding to the children besides the breast milk, and they insist that they were breastfed in that manner and they've grown to be healthy, and so what is the harm in including other substances while breastfeeding. This has been a huge challenge for us because they tend to threaten the wives that, you know, they would make the sons to divorce them or leave their homes if they do not include other forms of substances to breastfeeding. So these will have multiplier effects of improving our malnutrition and reducing child mortality rates in the country. Specific actions that will improve breastfeeding practices include the caregivers or mothers must be encouraged to initiate, establish, and continue breastfeeding as soon as possible after birth within the first hour after delivery. Mothers must be encouraged to practice exclusive breastfeeding from birth until 6 months of age. Mothers should be discouraged from giving any food or fluids other than breast milk for 6 months unless medically indicated. Usually when we go out to talk to people before COVID-19 and now with safer practices still, we usually try to make a physical demonstration by putting breast milk in a clear, transparent bottle, and we allow it to settle so they can see that part of about 80% of breast milk is made of water. And then the little part that stays at the bottom is more of the food substance that the child needs. We try to tell them that, you know, the size of the baby's stomach is a pea size, so they don't even need much things to be included, you know, added to what the breast milk would do. Because for a lot of women now, we're getting more enlightenment. So a lot of women understand the need not to give any other food to the babies, you know, outside breast milk. What we are still battling with is that they believe the babies need water outside the breast milk. And we keep telling them that even the breast milk is made majorly of water, so they do not need to add water to what the baby is already taking. It even exceeds the capacity of the baby's stomach. So it's a huge challenge, but we're getting there. We need policy advocacy to the governments to put in place an enabling environment for mothers and caregivers to breastfeed. For instance, the extension of maternity leave from 3 to 6 months to enable working mothers practice exclusive breastfeeding. Governments should create creches and lactating rooms in ministries, departments, and agencies to encourage breastfeeding. The private sector must do the same. World Breastfeeding Week campaign should be championed and supported by wives of governors in their respective states, considering its potential of promoting the practice of exclusive breastfeeding. Governments must enact and implement laws that can improve breastfeeding by stopping the inappropriate marketing of breast milk substitutes, including infant formula, feeding bottles, and teats. Also, the National Code of Marketing of Breast Milk Substitutes must be strengthened. Breastfeeding awareness and campaigns must be promoted through the media, the radio, TV, print, and social media. In conclusion, sorry I took so long. In conclusion, I would like to thank His Excellency, the Governor of Kaduna State, for his strong will and commitment towards promoting, protecting, and improving breastfeeding situations in Kaduna State. My deep appreciation goes to our development partners for their technical, financial, and advocacy support in reaching out to policymakers and other influencers within the government cycle for better policies. Strategies, funds mobilization, all these have been geared, have been aimed through the help of our development partners. And our development partners include Save the Children, we have UNICEF, the World Bank Nutrition Project, Alive and Thrive, CSUN, UNFPA, GAIN, and the list goes on. Thank you so much, and God bless you.
Thank you. I think that was a great summary. It's not easy to tell us everything that Kaduna has been doing. I think nobody doubts that Kaduna is at the forefront of the nutrition effort, and the political will seems to be the key there. So we can see the level of commitment, and we can always portray Kaduna as an example. I think I have to apologize again because it looks like, I don't know if I'm imposing a new fashion introducing people after they talk, or is it that I just feel that this is my nutrition family and I forget people have been introduced. So let me go backward and do a proper introduction of Her Excellency. So let me start by saying Her Excellency For me, the most important part here today is she's a happy mother of 3 children. So we're talking not only with a leader, but we're talking with somebody that lived it and knows what she's doing and knows the benefits of all this. Beyond that, of course, she's the wife of the governor of Kaduna State. She's the chairperson of the Kaduna State Emergency Nutrition Action Plan, a program that addresses nutrition, women and children's health, and related development issues in the state. She holds a bachelor's degree in political sciences from the University of Abuja, has experience working both at the public and private sector. As an advocate and champion for children and women in the state, she proactively engages a wide range of stakeholders, including policymakers, frontline health workers, and other public and private sector workers, to attract funding opportunities for Kaduna State to find malnutrition, BVF, and other related maternal and child health conditions. So we're very aware she's very active, not only in nutrition, but on women empowerment. She's been lately very active in fighting against rape. So for us, it's a big honor. And thank you again for your contribution. For everybody, remember we have the Q&A, so please keep on asking questions in the Q&A. All the panelists will be available to respond at the end of their presentations. So moving on now, we'll call Purity Oriaifo, Save the Children's Girl Champion, to tell us how she believes herself, other children and youth can support promoting and protecting breastfeeding. Purity, please.
Good day, everyone. Standing on the existing protocol, I'm so excited to be part of this meeting to talk about exclusive breastfeeding. Breastfeeding is widely recognized as the optimal way to feed a baby. Its positive impact can be seen not only in the infant, but to the mother and also in the lives of the parents. The health and also the healthcare system. So therefore, the importance of breastfeeding cannot be overemphasized. How can breastfeeding best be promoted, supported, and protected? As children, dialogue discussion would be of help because some mothers in our community are ignorant on the importance of exclusive breastfeeding. So therefore, as children who have knowledge on this, we could provide necessary information on both the benefits and the successful practice of exclusive breastfeeding. So we can possibly inform our mothers at home, our neighbors, we can reach out to talk to them on this issue. For example, reasons why they should practice this, the benefits, and also the dangers of neglect, and so on. In our various schools, we can enlighten our friends, our classmates on this topic so they can as well pass the information to their mothers at home, their neighbors on the benefits of exclusive breastfeeding. Lastly, as part of Children's Parliament, a platform set up for children to express themselves, to speak up for themselves, how it affects them. We can seize this opportunity to talk about breastfeeding to our leaders, like the President, the Ministry of Women Affairs, and other stakeholders, to tell them what we want as children, how we feel exclusive breastfeeding can be a reality. So this is my opinion to make exclusive breastfeeding a reality. So we can, like I said, we can seize this opportunity through this platform, the Children's Parliament, where we can make decisions, and of course our parents can help us and our leaders. So this is my opinion to make exclusive breastfeeding a reality, and I feel it will be of great help to make this happen. Thanks.
Thank you, Purity. I seem to hear some conversation about Dr. Chris from FMOH joining us. Can somebody confirm if he's there and ready to give the goodwill messages? It doesn't look like. Okay, so we're trying to locate him. Can you raise your hand, Dr. Chris? Maybe we'll move on until we locate him. So thank you, Purity, once again. Our next panelist is Mr. Abdulsalam Ozigis. I hope I didn't destroy your name. Deputy Director in Registration and Regulation Affairs from NAFDAC. Maybe he can tell us a bit more about himself, because now I was ready to introduce him properly. I don't have enough information. So you're welcome, sir. Please go ahead and tell us more about yourself if you want, but otherwise we would like you to talk about the role of NAFDAC. So we are aware NAFDAC is an important player protecting breastfeeding by regulating the marketing and sales of commercial infant formulas and other breast milk substitutes. We would like for you to briefly tell us the regulations that are in place in Nigeria that promote and protect breastfeeding, and what is the role of NAFDAC in ensuring the compliance. Please go ahead. He just dropped from the call now, that it was his time. Okay, he's trying to connect again. Technology always plays these tricks. He's been there all along and it disconnected when he had to talk. Welcome back. We're ready to hear you, Mr. Ozigis.
Hello, it seems we don't have him. Can you call the next speaker, please? Karina?
Okay, so that will be you, sir.
Okay, no problem.
Let me do the proper introduction. So,
okay, go ahead.
Let me try this time, see if I can get it right the last time, at least. So, distinguished Senator Ibrahim Yahya Oloriegbe. Oh, now Mr. Ozigis is back. Maybe let's go ahead with the Senator while we're sure that Mr. Ozigis' network is reliable. The Senator, he's also Nigerian medical doctor and politician. He graduated from Ahmed University in Zaria in 1985. He has attended, I'm not going to start listing the number of trainings that he has attended. He has practiced as a clinician in the Nigerian health sector since '85 and worked both in public and private sectors. As a politician, he was the majority leader at the Kwara State House of Assembly from 1999 to 2003, and he currently serves as the senator representing Kwara Central District in the 9th National Assembly. He's the chairman of the Senate Committee on Health and a deputy chairman, Senate Committee on Diaspora and NGOs since June 2019. And as many of us know, he has worked on development for many years in different capacities. He's also a proud father of 4 children. So, distinguished Senator, you, as I said, you have been involved in the development and implementation of many health and nutrition policies, plans, strategies, laws, and administrative frameworks. Can you tell us, in your opinion, what is the role of the legislature in protecting the planet by creating an enabling environment for breastfeeding and good nutrition overall?
Thank you very much, Karina. Your Excellency, the wife of the governor of Kaduna State, I think all other protocols, as we say in Nigeria, respectively observed. I'm delighted to be participating in this year's World Breastfeeding Week, we've been organized by Save the Children, and I counted it as an homecoming. Having in the past been part of the team, I've worked with several of the Save the Children team before, and specifically on nutrition. I'm aware that this year's theme is innovative strategies for improving breastfeeding and nutrition framework in Nigeria. At a time like this, when the Heart Planet is facing a plethora of public health and socioeconomic challenges, ranging from COVID-19 pandemic to climate change and socioeconomic challenges and socioeconomic upheavals, I consider the theme of this year's World Breastfeeding Week support breastfeeding for a healthier planet a very apt and timely theme. I once again wish to thank Save the Children for putting together this webinar and inviting me specifically to speak on the topic, legislative and policy makers' role in promoting a healthy planet for breastfeeding. I appreciate and salute the legendary effort of Save the Children in saving the lives of children and promoting their healthy development, being cognizant of the fact that the behaviors and activities of children later in life are partly or mostly predicted on the quality of breastfeeding in their infancy and early childhood. Those things have direct correlation with the state of health of the planet. Before delving into the substance of my assigned topic, I wish to buttress the fact, just as stated by several speakers earlier, that breastfeeding, or breast milk rather, is a crucial food for children's health and development, especially in the first 1,000 days of life, which is equivalent to 2 years of life. Breast milk provides the infant and the child with all the essential nutrients, enzymes, and antibodies they need to grow and thrive in the first 6 months of life and continue to be a vital part of their diet in the first 2 years of age. Breastfeeding supports healthy brain development, which is crucial to good behavior later in life. It's also crucial to higher educational achievement and lower the risk of malnutrition and other chronic diseases. And suffice to say that even it will contribute to the protection of our planet Earth, because a child that is well breastfed is most likely to attain a very good higher level of education, higher productivity, and will be amenable to promoting the planet in future. It is triad that a woman's ability to initiate and sustain breastfeeding is influenced by a host of factors. This includes the community or planet in which she lives. A woman's community or planetary environment has various components. And in these particular circumstances, I'm looking at planet beyond just the physical. So such community or planetary environment include the government in place where the woman is, the public health, and other community-based programs that in the environment where the woman lives, the various organizations, religious institutions, educational system, the traditional and cultural institutions, the physical, biological, and chemical environment, the economic environment, and the social environment, including even the kind of media that is available in such a woman's environment. All this, in one way or the other, have influence or have effect in the ability of a woman to practice breastfeeding. The extent to which each of these entities support or discourage breastfeeding can be crucial to the mother's success in breastfeeding. The Health Committee of the Nigerian State Assembly, which I'm privileged to belong, and which I'm privileged to be the chairman of this Committee on Health, is cognizant of the imperative for promoting a healthy planet through enactment of legislations and laws that create the enabling environment for women to exclusively breastfeed their babies for the first 6 months of life and continue breastfeeding with complementary food until the child reaches 2 years of age. Our legislative roles in promoting a healthy planet for breastfeeding, as captured in our health legislative agenda 2023, are encapsulated under 3 major constitutional roles, which we are charged with. These are legislation, oversight, and appropriation. Under our legislative role, we are in the process of reviewing the National Health Act 2014. The Act officially recognizes Nigerians' right to health, and through the National Health Act, the Basic Health Provision Fund provide financial resources to improve primary health care. We intend to amend the relevant section of the Act to make it more universal health coverage friendly, compliant, and supportive for breastfeeding and nutrition. The Nationality Insurance Authority Bill, this is a new one because what most people are aware of is the National Insurance Scheme Bill or Act. This bill, which I am privileged to sponsor, has passed the third reading at the Senate and just before we went on recess, and it is now before the House of Rep for its concurrence. We hope as soon as we resume, the National Insurance Authority Bill will come into being because to be presented to the President for assent. That bill, or when it becomes an act, is geared towards the attainment of universal health coverage in Nigeria, and we create an enabling environment for optimization of breastfeeding and nutrition in Nigeria. The 6-month maternity leave bill, the Senate Committee on Health, pursuant to one of its key breastfeeding promoting agenda in our health legislative agenda, is currently working on this bill. The bill will serve as a major vehicle to drive innovative strategy and policies that will promote breastfeeding in Nigeria. The bill, among others, will encourage and support working class women to stay at home and exclusively breastfeed their children for the first 6 months of life and continue breastfeeding until the child clocks 2 years. The bill will make for breastfeeding breaks and designated breastfeeding space at workplaces. It will also provide for the prioritization of breastfeeding mothers and children at health facilities and other public service delivery points, and provide activities to support education in nutrition for breastfeeding mothers, including peer support. Under our role of oversight, we are oversighting the Federal Ministry of Health and tertiary facilities. We are committed to ensure that all our health facilities are compliant with the baby-friendly policy and observe all the 10 steps to successful breastfeeding. And we will ensure that NAFDAC strictly enforces the international code for marketing of breast milk substitute using our oversight responsibility. Under our appropriation responsibility, we are working to steadily increase appropriation for the basic health protection fund and to increase overall health allocation of budget, with a view to supporting and promoting free and highly subsidized healthcare services to pregnant women, breastfeeding mothers, and their babies, to provide quality maternal, newborn, and child health care in Nigeria and enhance nutrition education services in Nigeria. In addition to our role, or my role specifically as chairman and member of Senate Committee on Health and Primary Health Care, I work with my colleagues in the National Assembly to implement other necessary legislative intervention that will promote breastfeeding and safeguard the planet. This will include promoting girl-child education, women economic empowerment, gender equality initiatives, eating and living healthy by all citizens to enable sustainable environment and healthy living. In conclusion, the promotion of breastfeeding is an investment in human capital and an investment in the health of our planet. There's a need for concerted effort by governments, policymakers, healthcare providers, development partners, religious institutions, traditional institutions, civil societies, and the academia to promote and support breastfeeding, which will ultimately have a positive impact on the health of our planet. It is a journey, and together we can achieve this. Thank you for listening, and thank you for inviting me once again.
Thank you, sir, for very encouraging words. It's very good to know that there are many things that are already in place. You're aware we had high expectations for you since you started, and we knew you were going to transform this. It's very encouraging to know that there's work being done around work in supporting baby-friendly initiative, strengthening NAFDAC, and beyond that is supporting women to be able to breastfeed and on healthy living. So I think there's some momentum, and it's very encouraging to know that the legislation has a role, but not only that they have a role, is that they are already at it, and things should change and improvement will be seen in the near future. Thank you once again. Let's go back to Mr. Ozigis. Hopefully technology would be better now, and he can tell us about the regulations that are in place in Nigeria and the role of NAFDAC. Please go ahead. Or he has left again.
He's there. I think he's there. We can see him.
Can we? Okay.
He's there. That's him.
But
Maybe he can't hear you. I think the better is maybe they should unmute from your side for him to do.
he's unmuted. Mr. Ozigis, can you hear us? Ah, there he is.
I've shared a document. I don't know whether it's appearing to everybody.
I don't know. Has it been received? My colleagues that are behind the scenes. Can somebody confirm if we have? Okay. Okay. So you're sharing your screen. That's great. Yes, we can see it. Please go ahead.
Thank you very much. I want to stand on existing protocols. After wasting that technology time, I think I should go straight so as for make up for time. Ozigis Abdulsalam, currently a Deputy Director with National Agency for Food and Drug, a child advocate, and an advocate for compliance to the code and breastfeeding. I'm a friend of the babies. Thank you. When you want to understand what role NAFDAC really plays, there is a crucial question we must always answer. The question is, why do we even need the code? The code has become such a big word that people hardly could understand that in its simplicity form is part of human behavior of guiding what should be done for the sake of our children. So for you to really understand the role of NAFDAC, we need to start from why do we need the code in the first instance? And we need the code because this code This is the code, excluding the subsequent amendment of WHO basic minimum requirement for compliance to the code. Subsequently, there have been World Health Assembly resolutions, which this code in itself has asked that subsequent World Health Assembly resolutions are in addition to this very basic, what is required to be implemented in each country. In answering the question, why do we need the code? Let's take some basic information. Suboptimal breastfeeding account for an estimated 1.4 million deaths in children under 5, as Lancet as far back as 2008. And in the same year in Nigeria, we are having 30% of babies as exclusively breastfed at 7 months of age. I'm taking us back to know why this code is very essential. We should not just consider it in the realm of current, but let's take ourselves back in history. And there are so many risks associated with not breastfeeding babies in all countries of the world. There's increase of diabetes, increased risk of air infection, potential reduced IQ score. Bottle feeding affects dental occlusion. In fact, it causes mimicking with breast nipple. That's nipple confusion. Increased risk of cut death, is more costlier than the breastfeeding, and also increased risk of eczema, increased risk of osteoporosis in later life, increased risk of menopausal breast cancer, and increased risk of ovarian cancer for not breastfeeding a baby. There are current concerns in terms of intrinsic contamination of infant formula. Powdered infant formula are not sterile products. We must remember that. They can become contaminated at factory level with heat-resistant, pathogenic, and highly contagious Enterobacter zakazaki, and that's a very deadly organism in children. Highlights of risk of artificial feeding and implication on health beyond this Enterobacter zakazaki that is so deleterious to children. There are so many other issues as enumerated in the first diagram or picture there. The risk of formula feeding includes so many other things that develop later in their ages. I want us to take a look at World Health Assembly Resolution 58.32, 2005. Member states are enjoined to ensure information and training by healthcare providers on the preparation, use, and handling of powdered infant formula. It also required that inform that powdered infant formula may contain pathogenic organisms and must be prepared and used appropriately. Ensure explicit warning on packaging material. This is one area which NAFDAC has enforced on the label. If you notice on the label of most infant formula, few years ago, there were pictorials, look-alike, child-like pictures and depictions. All these have already been taken care of in most of the infant formula being marketed in the country now. And World Health Assembly's resolution requirements are also being implemented. If you notice now in Nigeria, you see that warning coverage has been put in terms of the pathogenic organisms for caregivers and mothers to be aware of the possible intrinsic contamination of this formula milk. If we take a look at WHO guidelines 2007 for minimizing risk of contamination, these are parts of what is required in the labeling now for you to have your infant formula registered or marketed in Nigeria. Generally speaking, there are problems of contaminated milk not restricted to one country. It's global. We have had in 2000 where more than 70 recalls of infant formula, mainly industrialized countries, occur. There are examples of recall in the past years listed here for those who want to have a knowledge of trends globally. And in local environment in Nigeria, NAFDAC also have trends and data bank of issues that have occurred as violations in non-compliance to breast milk code and regulations. Generally speaking, all producers competing in the marketplace do so for two reasons: to type, and also they also compete to expand the share of the market, present and future, over that of their competitor. Is their corporate ambition is to dominate market. And if you see figures in US dollar from 2008 till date, has been on the increase in terms of sales accrual to all these companies. So why did they do so much gain from sales of these infant formulas? They gain so much because of inappropriate marketing. Inappropriate marketing, which they are not supposed to do if they comply with the code and regulations that exist in the world, or in Nigeria especially. Achieving these goals of compliance to the goal, to the code will require clever marketing, and that's what they are trying to do. The more they try to tell you they are complying with the code, the less they actually comply with the code. Now, as breastfeeding rates are set to increase in short term, international companies are also focusing on launching new products targeting breastfeeding mothers. That's whereas WHO has said there's nothing like follow on, follow up, follow up. They are coming up with other products mimicking complementary feeding, which are actually baby milk substitute, can knock out breastfeeding at the relevant child's age. Promotion of BMS influences infant feeding behavior. Of course it does, because studies have shown that, like I've said before, nipple rejection of mimicking teeth with nipple make child to reject breastfeeding if you are using teeth and breastfeeding infant formula through the use of feeding bottle and teeth. Companies spend huge amount of money to persuade mother to give up breastfeeding and switch to breast milk substitute. And that's well known. What we do exactly to counter this is that we have upgraded most of our tools, and these tools include the law as well as the regulation, which the Honorable Senator has talked about, which one is pending for review. We have law before now, but it needed to be updated to be brought to for the circumstances which we are having now. And that's why that review was done and is being presented for consideration of the Parliament. Successful code implementation prohibits unethical marketing practices that undermine breastfeeding, and companies know this very well. And the sales of BMS products, substitutes, is of concern to government across the whole world, because there are significant international variation in the regulation governing the marketing of breast milk formula. While the code is the minimum that must be complied with, each country is supposed to look internally and also impute certain extra needs into their regulation as they domesticate the code. The industry is fighting a rearguard action against regulation on a country-by-country basis. This is an old code implementation country by country. There's a recent one launched last month by WHO, which is most current, and it shows that where the laws of each country are, whether there is law, whether there is no law, whether there is regulation, whether there is no regulation, whether there is compliance in the health sector by caregiver, whether there is compliance by manufacturers or distributors or marketers of infant formulas. The launch was done by the WHO in May, and that one is already in circulation for those who want to access the up-to-date information. Enforceable legislations. Company will respect the law if enforced. In response to regulatory changes in Brazil of recent, company changed their label as of 2002, label from isomil and similar to no longer show rascal beer. The rascal beer is the beer that's a childlike inducing marketing strategy. Happily, NAFDAC has enforced all this labeling requirement now, and you hardly see depiction that resemble baby or baby-like on the labels of all infant formula in Nigeria now. NAFDAC role in this implementation of the code, as well as the national law and regulation. There was a law, or we still have a law, Act number 41 of 1990 on marketing of baby milk substitute. The Amendment Act of 1999 as an Act number 22, formation and launching of marketing of infant and young child food and other designated product registration sales, Regulation 2005, which was launched in 2006 by the then Honorable Minister. I'm happy to announce that this regulation has been reviewed in 2017, and we are already implementing the new reviewed format of this regulation. Monitoring instruments in form of questionnaires and checklists were developed a long time ago, and I'm also happy to say the review of these tools have been done by NAFDAC, and it's a national tool that is available for monitoring and enforcement at health centers, sales centers, and caregivers as well as the regulatory agency in collecting a database. These tools are used to collect compliance level at each state, and NAFDAC is the database collecting center. Once these informations are collected for the use and references. Now, we also organize and conduct training on the code for implementers and other stakeholders that include support from UNICEF, Save the Children, Alive, and Tribe. They have supported us severally in delivering on the mandate of code compliance and enlightening people on what the code is all about and what the regulation said should be complied with in Nigeria in terms of breast milk subsidy regulation that is very relevant in promoting breastfeeding. The normal stakeholders that we train include, well, ourselves. The government policymakers are very vital because we need a lot of advocacy to them for them to buy in into the implementation of the code, and as well as in promulgating the relevant laws that are needed for us to operate the code. We also train regulatory agency, health worker, professional association, media men, women organizations. In fact, at the beginning, we had to bring the infant manufacturer and distributor to the training for them to be able to know the role they are expected to perform at the beginning. But currently, we don't bring them because the code defines their function as to comply with the code by manufacturing goods, that is the food or BMS products that complies with the code. That's the only rule they are supposed to do, and comply in totality to the labeling requirement, distribution strategies, as well as all other World Health Assembly resolutions. Right now, they can no more donate, no free donation, which in the earlier World Health Assembly, they can donate by passing through the national competent authority, that is NAFDAC, to apply for what they want to donate, who they want to donate with. But as current requirement, no more donation. All required baby milk substitute must be purchased by government or donors through the required procurement procedures. Journalists are not left out in our stakeholder training, and we have done a lot of training with the support of Save the Children and so many other NGOs to bring them to acquaint themselves with their role expected of them in the code implementation.
Sorry to interrupt. I will have to ask you to round up. We're running short of time.
I'm rounding up quite actually. I'm happy to say though that the code monitoring and enforcement in the agency has been institutionalized, and we have relevant statistics already being generated. And there have been surveys in the past 2005, 2013, 2014, and current ones that are on the pipeline using the new tools that are available now. As I mentioned earlier, we have reviewed the Marketing of Breast Milk Substitute Act, CAP M5 Elephant of 2004, and it's been tendered for consideration into a new law in the National Assembly. Unfortunately, we did not succeed with that in the last legislative dispensation, and we are hoping in this new dispensation it will be made into law. Also, we have also got the Council of NAFDAC to approve the reviewed Marketing of Infant and Young Children Food and Other Designated Product Registration and Regulation 2005, and now reviewed to include all relevant requirements and World Health Assembly resolutions that were not in 2005. That is, it's a real updated regulation. Like I said, the updated training manuals, advocacy tools, and monitoring tools has also been updated as a date for use. Now, we are enforcers of the compliance requirement to the code of BNL, and we are doing that because labeling requirement is very necessary. All products have now complied with labeling requirement, but there are still some lapses, and we are tackling it in the agency. The revised document on training has also been adopted. A real-time reporting tool is also being developed. It's not been deployed yet, so that people can report violations online. In conclusion, breastfeeding is the most effective preventive public health intervention to reduce infant mortality and morbidity. Formula companies produces breastfeeding, reduces breastfeeding, of course, with their own antics of promotion and increase the use of breast milk substitute. Yes, of course, breast milk substitutes are legal products, but they must be used, marketed in the most appropriate way as required by the code. Implementation of the International Code of Marketing of Breast Milk prohibits the unethical marketing practices that undermine breastfeeding. In Nigeria, NAFDAC is entrusted to implement the regulation and code of BMS and all subsequent WHO resolutions to keep up to date with the initial code of 1981. I rest the case here with this conclusion to give room for questions that may arise. Thank you very much for listening.
Thank you, Mr. Ozigis. This was a very enlightening presentation about the code and the role of NAFDAC, and we're very much aware of all the efforts NAFDAC has been putting towards this. We're running a bit short on time, so I may have to indulge you 5 minutes more of your time. I would like now, before I hand over for the Q&A, to finally, last but never least, call Dr. Chris to give us some remarks at this goodwill messages because of World Breastfeeding Week. So Dr. Chris Isopungu, Senior Special Advisor, sorry, I'm not getting used to your new title, to the Honorable Minister of Health and Head of Nutrition. Please, can you give us some remarks?
Yes, thank you very much. Ladies and gentlemen, Your Excellency, the wife of the Governor of Kaduna State, it is very distinguished Senator Ibrahim Oloriegbe. Ladies and gentlemen, I want to thank you very much for the opportunity to address us, to give a goodwill message. As a matter of fact, I am always excited when people gather like this to discuss nutrition and especially breastfeeding. And I've followed and listened very keenly to all the discussions. Earlier today, the Honorable Minister had a joint press conference with the Honorable Minister of Women Affairs, where both of them reaffirmed their commitment to promoting breastfeeding in the country. For us in the Federal Ministry of Health, it is non-negotiable that breastfeeding is very important to the survival of the child. And if we are to reduce under 5 mortality in this country, we must focus on breastfeeding and in fact, infant and young child feeding, which is why we always champion the global celebration of the World Breastfeeding Week. I want to thank the Save the Children for putting up together this webinar, and the discussions have been very enriching. Particularly, I'm happy to hear what's going on in Kaduna. In fact, Kaduna is championing the breastfeeding move. It is in Kaduna State that we have a triplet that was exclusively breastfed successfully, and that is a story that we continue to share on all our different platforms. To promote breastfeeding in the country, Nigeria launched the Zero Water campaign in recognition of the fact that the biggest threat to exclusive breastfeeding was that children were given water along with breast milk. And the goal is, if people are convinced to give children only breast milk without water, then the exclusive breastfeeding rate will go up. I want to use this opportunity to call on all of us to continue to be advocates for breastfeeding, because we know it is crucial to the survival of the child. Innovative strategies for improving breastfeeding and nutrition in Nigeria abound. The Zero Water campaign is one of such innovative strategies that we have used with the support of Alive and Thrive and UNICEF. And we'll continue to explore other strategies to reach out to people, to convince them to deliver the right messages and to be able to breastfeed their children correctly and appropriately. I know we're short of time, so I'm going to stop at this point, but just to let us know before I go, that the Honorable Minister of Health sends his good wishes to this webinar and wishes all of us very happy World Breastfeeding Week celebration. Thank you.
Thank you, Dr. Chris. I'm handing over now to my colleague Innocent, who will be moderating the Q&A session.
All right, thank you, everyone. I want to stand on the existing protocols so that I don't waste so much time. We have the following questions. I'm just going to read them, about 16 of them, so that the panel members will take notes of the one that is directed at them. The first one is, what is the exclusive breastfeeding rate for Kaduna? That question is directed to Her Excellency. The other one is, what is the exclusive breastfeeding rate for the Federal Republic of Nigeria? I think that has been answered. Is I think 29%, according to the NDHS 2018. And then I move over to the other one. Good job, Your Excellency. How can we harmonize all data of exclusive breastfeeding and IYCF and other nutrition services in Kaduna? Is it possible to have a nutrition information management system in Kaduna? The another question is, I would like to start with a community campaign on breastfeeding in Edo State. How can Save the Children assist my organization? I think this will be directed at the moderator. She will be able to provide some clarification on that. I am Dominic Elwe. I would like to know what the Kaduna State government is doing to support the children of displaced people of the Southern Kaduna and to ensure that the children are exclusively breastfed. Thank you. Another one is kudos, Purity, and Maryam, Ahmed. Children and young people are indeed great influencers. Please share your ideas on how the serious generation gap between traditional grandmothers, mother-in-laws, and their sons' wives. Yes, their son's wife on insistence to add fluid to breast milk can be bridged in this ICT age. The bill of 6 months maternity leave is ongoing is it going to be applicable to mothers working in private sectors as well? I think this is directed to distinguished Senator and Her Excellency. Please, what is Kaduna's government doing to prevent social norms or harmful practices resulting from gender inequalities? What strategies should partners be considering in involving husbands and fathers of women in informal sector, especially in poor and rural communities who are not privileged to enjoy 6 months maternity leave to ensure support and compliance? At High Excellency, are we expecting an accelerated passage of the 6 months maternity bill in Kaduna State? How soon will you say? Your Excellency, Ma, what implementation strategy do Kaduna State have in place for all the policies you mentioned in your presentation? Thanks for your presentation. This is for Dr. Ozigis. What is the level of compliance by NAFDAC in Nigeria with all the WHO regulations? Dr. Ozigis, how do you ensure abandoned babies at orphanages have access to breast milk substitute in light of non-donations of same? Thank you so much, NAFDAC. Please, is the training manual on breastfeeding code accessible to health workers? How do we assess it? Thank you, Ozigis, for your presentation. After the 6 months exclusive breastfeeding, are you saying it will be still bad for the young child to be placed on infant milk? Please expedite action on the rationale behind the Zero Water campaign. What is the proportion of women using bottle feeding? I commend Kaduna State for good job, for job well done, but my concern is what happens to the vulnerable women of childbearing age at the hard to reach communities of the state. Are they part of your beneficiaries/interventions? Thank you. I think that one is directed to Her Excellency. I think I have only 3 more. Talking about the BMS code, is it possible for government to regulate the activities of the production of breast milk supplements in order for it to be restricted to usage of special cases instead of making the supplement to be available for general use? Bottle feeding is considered normal globally. Unfortunately, even with an enlightened population, at times social norms and shaming people, it's difficult to breastfeed for a longer period. Is there anything the government of Kaduna State is doing to raise awareness that there is need to shame people who breastfeed babies no longer than what is considered a proper duration? Finally, question to save the children. Under today's theme, breast milk formula harms the environment, but under today's theme, breast milk harms the environment, but how low income homes, mothers still, oh, this is jumping. Question for Save the Children. Under today's theme, breast milk formula harms the environment, but for low-income homes, mothers still need to cut woods to produce meals to eat. They have to fetch waters from personal meals and cook with wood, which adds to pollution. The mother has to eat to be able to bring about enough milk. So does breastfeeding really affect climate change in such grave range? Thank you. Over to the panelists for them to provide clarification on some of these questions. So I start with Ahmed, Maryam.
Thank you. I think based on the question was basically asking how young people can bridge the generational gaps in terms of when, maybe grandmothers have different views on breastfeeding while you have a more informed view on breastfeeding. I think and then also relating it to the modern ICT age. I think these days, in this generation, information is more accessible on the internet, more accurate information than before in those times. So I think it just has to do with sensitizing those other generations, the grandparents and the mother-in-laws, on the proper ways to breastfeed. They may have different norms from their time that are not necessarily true or are not necessarily beneficial to the child. Maybe, for example, they might say, oh, a norm is you have to pour out the first breast milk, which maybe it's the most it's the first breast milk that has the most nutrients, for example. So it just has to do with sorry, it just has to do with sensitizing them and letting them know that, you know, this is what, for example, WHO says in a research. It's more nutritional to give your child, to exclusively breastfeed your child for 6 months than, you know, how they would normally do it in their time. And then also it was even brought up on this call that, you know, parents, by Her Excellency, that parents in rural communities and in older generations prefer to, you know, feed their babies water. But then you just have to sensitize them and teach them that, you know, breast milk has more percentage of water than, you know, the nutrients, so they don't need to give the babies water in addition. So, you know, it just has to do with sensitizing them. Thank you.
Thank you. So I take Mr. Ozigis to provide the answers to some of the questions. Thank you.
Thank you very much, Innocent. I have a couple of questions to respond to. And the first one I would like to take is on the regulation of BMS products for special cases instead of general use. BMS products are, in fact, legal products globally, and they are for special use, special dietary needs. And it's on the basis of that they are classified as such, diet for special dietary needs of children, and they were registered. The real thing we are required to do is not the usual thing that happens to other products, like any other products, food products being used. What we are expected to do, and what we do, is the fact that we are to implement this product use without the usual marketing strategies, which you can just use in marketing any other products. So it's in the light of control and regulating its use for the purpose it's meant for that the marketing is regulated. This is the only food product you find that is not marketed in the usual way of marketing gimmick, advertisement, promotion, and the likes. So the regulation and the code is meant to answer your question. Compliance to the code or the national regulation will ensure that the BMS products will only be used in special needs for special requirement of child at certain age, taking cognizance of the need for breast milk feeding between the age of 0 to 6 months, and of course, where a special need arises in the absence of breastfeeding, which is not determined by the child's caregiver, the mother or parent, but by the child caregiver that must recommend in place of mother, dead mother, or in the place of a non-existence of surrogate mother, or whatever the case might require the special need for its use. That's exactly what happened. And the code is there to strengthen compliance by everybody. There's compliance for health workers. There's compliance for even manufacturers, as you are saying. They must all comply and not make it available when it's not supposed to be made available. For the access to training manual, of course, yes, anybody that needs it should contact the agency, and it will be given out. It's a Nigerian document. It's for everybody's use. Now, the other question is, do I mean that baby milk formula cannot be used after 6 months? No, I didn't say so. After absolute 6 months breastfeeding, there is need for continuous breastfeeding for 2 to 3 years, in addition to complementary need at 6+ forward. That's exactly what the code says about it. Where after 6 months, breastfeeding can continue for as much as 2 to 3 years, in addition to the complementary food that will be added, because the child now needs extra home food or whatever to cope with this development. Level of compliance. Of course, this level is never static. The last level of compliance I know of, there are more compliance in rural areas than upper centers. I can't give you specific percentages now, but it's true that if you are really into the field work, you discover that the rural people do not even have the means to even go for infant formula in the first instance. Like it's mentioned here today, most of the problem they have in rural area is not the fact that they are not breastfeeding, but probably because they are breastfeeding in addition to adding water in the first 6 months. Now for the children in motherless homes and other camps, another question asks, if they say, as we are saying, the regulation now worldwide is that no donation of infant formula. Infant formula are supposed to be procured for descendants in camps and abandoned children's homes through normal procurement policy. That is the rule. Before now, there used to be donation of these items, but the manufacturer and distributors of this product turn it into marketing gimmick. They will use political leaders to market their product and say they are donating. And we look at it dispassionately, how many people will consume it, what age and length they will consume it. But once they donate this thing, there's no reorder time. They are supposed to refill when the need arises. They don't refill. That was why WHO's Assembly has said that no more donation of infant formula. If it must be procured, if it must be made available for them, government should make the budget, donors should make the budget and buy through the normal procurement procedure. Lastly, I think the other question is not really for me. I think my other panelists will answer that. I stop for now. Thank you.
Thank you, sir. So I go back to Her Excellency so that she will take some of the questions that are directed at her. Thank you.
Okay. Thank you. So thank you all for the questions. I believe that there are 2 questions that I can merge to answer together. There is one that asks about how we intend to harmonize breastfeeding interventions in Kaduna State. And there's another question that asks about our implementation strategy on breastfeeding. So for our interventions, we have at our primary healthcare centers, we have come up with a new approach where we adopt an all-integrated healthcare service. So we have integrated healthcare services in all these PHCs where everything regarding nutrition, exclusive breastfeeding, early initiation, even when to start complementary feeding, and even practical cookery, where women are taught, how to put together easily, readily available foods that are abundant in our areas, peculiar to certain areas, how they can come up with nutritious meals. So we've decided to have an all-integrated services approach at our PHC so that all these issues can be taken care of and can be discussed at the same time. We try to target when women come for their antenatal services, and then we try to put all these together, and then we talk to women regarding this. We even talk to them about child spacing. We try not to call it family planning because it tends to trigger a lot of resistance. So we even talk to people about child spacing and things like that. We have nutrition health officers. They are in these PHCs. They help us to collect data of people that come to these PHCs for these services, and this helps us in trying to come up with you know, a holistic data structure for future interventions. For women in hard-to-reach areas, we have our community volunteers that help us go door to door. These are the ones that we call our food soldiers. They help us go door to door to talk to women about the need for the integrated health services that we discuss at PHCs. We have women who go door to door to help us talk to men in hard-to-reach areas on the same issues. We have women support groups that also help us do this on a larger scale. They help us mentor and teach to women about these areas. We even to create some sort of an award-giving kind of a process where we try to recognize those who actually listen to these talks and comply. Last year we gave an award to a woman with her husband who supported her throughout, you know, the period to exclusively breastfeed 3 children, triplets. So we try to do this as a way of, you know, motivating people and encouraging them to continue with exclusive breastfeeding and things like that. And regarding the acceleration of the passage of the bill, we at this point we are trying to, as soon as possible after this celebrate, we intend to hold an all stakeholders meeting so that the bill, everybody can have an input on what the bill should be. We want to perfect it, and then we're hoping that by the end of this year the bill would have reached the state assembly for passage, and by God's grace by the first quarter of next year the bill should be ready and in front of the governor of Kaduna State by the grace of God. And lastly, the first question about the breastfeeding rate in Kaduna State. The NDHS mixed survey of 2017 that has got multiple indicators has shown that early initiation in Kaduna State is at 28.9%. And then exclusive breastfeeding is at 19.7%. Thank you.
All right, thank you. I don't know whether Distinguished is still here.
I think he left. He responded to some of the questions in writing.
Okay.
I think in the interest of time, we may need to stop the Q&A here.
All right.
Because we're already almost 20 minutes over.
All right. Let me quickly do the call to action. First of all, my opening statement is that it is in our hands for us to improve the indices regarding exclusively breastfed children. It is all our responsibility and we should do that. First, let me thank all the panelists, all the stakeholders, the private sector, the MDAs, the government agencies that are here, development partners, CSOs, NGOs, professional associations, regulatory NGO, regulatory bodies that are here. I thank you all for participating, working and implementing and supporting nutrition activities, especially those who focus on infant and young child feeding. I thank you for all the good works you've been doing in the past. But the big question here is, how do we ensure that the number of children who are exclusively breastfed increase over time? We saw that it increased from 17% in the last NDHS to 29% in the 2018 NDHS. This is good, but that is not good enough. And because I have said before that it is the duty of everybody, So our quick response in that direction would be that to achieve this, all stakeholders have responsibility. The family have responsibility, the man, the grandmother, the mother-in-law, and other influencers, the support groups within the communities, they all have responsibilities. The community gatekeepers, religious leaders, traditional leaders, other institutions that shape our culture and belief systems. We all have responsibilities, and we should play this role to ensure that that woman in our community does what is expected of her, and that she gets all the support from the community. For the government, the ward, the local government, the state, the federal government, we all have roles and responsibilities to play by creating an enabling environment that will encourage lactating mothers and young women to exclusively breastfeed. The media, the CSOs, FBOs, development partners, private sectors, professional associations, and so many other organizations, we all have responsibilities to ensure that we do our best. So as Save the Children, we recognize the fact that a lot has been done, and we give a lot has been done towards improving our indices as a country. And so we recognize that federal government and state government have done a lot of interventions regarding the social safety net programs. So this is great innovation, but we think that they should scale it up and ensure inclusiveness, ensure that most women who are left behind, who live in hard-to-reach communities, are part of this, and disabled people, that they are part of this social network, social safety net programs, and they benefit from it. We also thank the Federal Ministry of Health for the Zero Water campaign, and as an organization, we want to align with this, and we say that we'll continue to work with the Federal Ministry of Health and the other development partners to promote and sustain the messages around the Zero Water campaign, because that is what makes exclusive breastfeeding what it is. Otherwise, once you introduce water, it is no longer exclusive breastfeeding. So for government, specifically, we urge Nigerian governments to ensure that creches are built in public and private facilities to encourage lactating mothers and young women to contribute to economic growth and development, as well as care for their children. Most times you see that creches are built in and located in facilities at the back or in hidden locations. So our call to action today is for government to ensure that where the creches are located, first of all, that all the facilities have these creches, and where they are located should be in a place where we will all have responsibility to ensure that the children are properly taken care of. The second one is to develop and implement policies, strategies, and plans that will encourage women to follow IYCF protocols as appropriate. There are protocols that are stated in IYCF strategy. So with those protocols, we are encouraging government to ensure that they create an enabling environment for it to be followed properly. Funding has also been a major challenge. We are working with Federal Ministry of Health to review some of the policies they have put in place to promote nutrition. And we noticed that funding has been a major challenge. And so we are asking that some of these policies and strategies and plans should be properly costed so that they serve as evidence for budgeting, and then ensure that there's timely release of this funding and then properly utilized. Again, I talk about improve, strengthen, and sustain various coordination platforms. At national, we have National Council on Nutrition, and we're urging states to also ensure that the State Council on Nutrition is also established and they are doing their work. Food and nutrition committees that are holding regular meetings at local government and as state government. I think I need to give Kaduna kudos, because we know that some of these things they have done, especially with the regulation they're putting in place to encourage lactating mothers to be able to breastfeed their children for 6 months. That is very important and laudable, and we commend Her Excellency and her team for that effort. We also want to government to ensure that they regulate effectively activities of breast milk substitute companies and ensure that they abide by the code. You know, again, monitor and document and report. These are very, very important. We also want to see that CSOs are part of the monitoring committees that are established at states, at various state levels. So we are encouraging Mr. Ozigis to take this back to the agencies to ensure that in every of the states where they are setting up the monitoring committee, that CSOs are part of that. And so they do proper monitoring, document, and ensure that their reports are appropriate. Finally, we urge the government at all levels to refocus the primary health care. We are happy with what Her Excellency has said that is happening at the primary health care centers in Kaduna State. So we want other state governments that are here present to replicate that for a greater result. So I am concluding now. Investing in nutrition now will create significant savings in the future for the families and for the economy at large. Exclusive breastfeeding is the business of everyone. So I urge you to get involved. I urge you to play your role. I urge you to be part of the movement and let us save our planet. Otherwise, in the near future, the number of the scientists, researchers, and technocrats we have in the country will reduce significantly because of the negative impact. Because of the negative impact this will have, again, it will also affect the economic growth and development. So let us work together to save our planet and improve the economic growth and development of Nigeria. So thank you. Permit me to hand over to my colleague and our head of health and nutrition, Karina Lopez, for her to be able to conclude. Thank you.
Thank you, Innocent. So I think we have gone way over time, so apologies for that. I think the conversation was so engaging that nobody wanted to stop. So on closing, I just want to appreciate enormously our panelists. Thank you very much for your contributions, for making this interesting to everybody. Thank you for all the participants and principally to those that stayed until the end. We appreciate all the support and we hope this is the beginning of a discussion. And as somebody said, we shouldn't be talking about breastfeeding also only in August. It should be all year round. That's what we do, and we're hoping everybody does. So thank you once again. Happy rest of the breastfeeding week, and we will continue working together. Have a good day, everybody. Thank you.
Thank you, everyone.